I'm a 47-year-old woman, and I am unhappy with the changing shape of my face. Please recommend filler or facelift. It seems to me that a loss of volume in the cheek area is causing everything to look out of balance. My nose looks larger, and my eyes sunken. I am also not happy with the laxity in my neck and jaw. My mouth has almost completely disappeared. Please recommend facelift or fillers to restore balance.
Thank you for your question. You submitted your question with several photos from different angles, and you're stating essentially that you don't like the way your face is changing at the age of 47. And specifically, you feel like your cheeks look more sunken and that it's making that your nose look more prominent and your eyes look different and sunken in as well. You also describe a situation where you feel like your mouth or lips have almost disappeared. And also you're concerned about the quality or the appearance of the skin of your neck. So you're asking fillers or facelift, and I think that's a really relevant question in the current time. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial, plastic, and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years, and helping people with facial aging has been a significant part of my practice. And there has certainly been an evolution in the options that we have to help our patients, as well as an evolution in the understanding of facial aging when I think of where we were 20 years ago compared to where we are now. So I think that your description is actually very accurate about what you're seeing in terms of, quote, things sinking in. One of the unfortunate realities of facial aging is that there is a significant change in bone loss. Bone, muscle, fat, and soft tissue actually diminishes, and therefore you look more hollowed. And so what would have been a strategy a few decades ago would have been to try to lift everything, to try to shift position of sagging tissue, what appeared to be sagging. In my practice and my approach now is more about volume correction. Now when it comes to volume correction, there are certainly many options. But what I lean towards is actually the use of different injectable fillers in a way that can provide the longest lasting benefit as well as the most natural appearance. So what does that mean? Well, if we look at the current choices of inventory when it comes to the fillers of specifically the hyaluronic acid fillers, like in the Juvederm family or the Restylane family, we have a wide variety of fillers of different thicknesses, of different behaviors, and so it's a very nice opportunity to actually customize the approach for every patient. So what we do often in our practice for someone like yourself is a procedure called structural volumizing. Structural volumizing is a concept where the use of long-lasting fillers, such as Juvederm Voluma or Juvederm Ultra Plus, is placed at the bone level where there is the most significant loss. And by doing that, you're actually able to restore a lot of the lost volume. Now you can never restore everything, but when you work at this level, one of the biggest fears patients have about injectable fillers is looking puffy, looking doughy, or when it comes to their lips, looking like a trout or a duck, and then being afraid of looking unnatural. There is an art to everything we do, and whether it's surgery or filler, I treat the procedures comparably. When I do this structural volumizing approach, I actually treat it like surgery, where we do things in a very sterile way, and between myself and my assistants, there's always this dynamic feedback of how things are looking. So we can restore the volume in the cheek area, for volume in the jawline, the jaw angle, the chin, and you can actually in many ways create the perception of someone having a facelift without having surgery. Not to mention, this procedure can take less than 30 minutes. Now, when it comes to enhancing the lips, you are also on target when it comes to the volume loss around the mouth. And although a lot of people who are, as they're getting older, are afraid of looking overdone, I always explain that lip volume correction is very different from lip volume augmentation. The point is that if you restore just a conservative amount of volume in the lips, it really makes the mouth area, or we refer to the perioral area, very nice and natural. Studies have been shown where the person, when a person looks at you, their eyes naturally go in this triangular shape in the center of your face, basically the eyes down to the chin. And so in that triangular area, it's very nice to have balance and proportion. Now, when it comes to the skin issues of the neck laxity, I think you'll find if you do something like structural volumizing, you might be able to get some tone back to the skin, but you have to also understand that a lot of times we're dealing more with the skin quantity differentiation from quality. So in other words, what you're dealing with right now is more of a skill quality issue. When someone has a lot of sagging, then facelifting is certainly appropriate. When the jowl has dropped below the jawline significantly and there's a lot of neck skin, then facelifting certainly is generally more indicated than volume correction. But in your situation, I think volume correction will make a bigger impact. So I would recommend you meet with qualified, experienced doctors who do this type of procedure. I think you're going to find yourself with kind of overwhelmed by the many choices you'll have. But I think understand that this concept of structural volumizing is not practiced by most doctors, and it really is a specific technique. And I say that doctors like myself who are surgeons have a certain perspective that's different from non-surgeons or people who have not done surgery at the deeper levels of the face and the bone. And it gives us a certain, I would say, an advantage in some ways of how to place the fillers in many ways as we would think of when we do facial implants. So that's also something to factor in if you'd like. So I hope that was helpful. I wish you the best of luck. Thank you for your question.